Anika Brahmajosula, and I am the events co-director of Medvocate. Medvocate is a fairly new organization, and our main goal is to provide opportunities to pre-health students and connect students with healthcare professionals to allow for mentorship as well as other opportunities. Before we get started, I'm just going to share a few quick announcements. We actually started an active membership, which relies on our point system. In order to become an active member, you must accumulate a total of 300 points a year. Events like this are 15 points, and you get those 15 points as long as you get a 7 out of 10 on the quiz, which will be provided at the end. Another way to earn points is to complete our assignments, and these assignments are going to be posted on our Slack group. Each assignment is worth 5 points. So now we'll get started with our event. Today we have Christy, who is a second-year dental student. She has had many volunteer and leadership positions during her undergrad as well as during her dental school. She's here today to share her advice and expertise. So Christy, thank you so much for being here, and you can get started whenever you're ready.
Hi, thank you all so much for having me. This is awesome. So I'll start the screen share, and feel free to just ask any questions in the chat. I don't think I'll be able to see it, but we can always address them more at the end too. Oops, I'm in the wrong spot. So yeah, hi, I'm Christy. I'm Christy Kaczmarek. I'm currently a second-year dental student at Harvard School of Dental Medicine, and I just want to go through like a quick overview of, maybe not so quick, but an overview of my path to dental school and just in general what the timeline looks like. So first, I don't know if you guys have this ability or like know how to annotate on Zoom, but if you go to the top, you might be able to annotate, and if you could just like write on this slide like one new thing you've done in the last 6 months, that'd be awesome, just so I can get to know what you guys are up to. And if not, you can also just put that in the chat or whatever you guys feel comfortable with. And if not, we can just keep going, and that's fine too. I don't know, I'm not able to see anything, but I can keep going. Feel free to put it in the chat. Let's see, is there anything? Oh, I see that someone has been learning to play a new song on the piano. That's awesome. Well, I encourage you all to keep trying new things. I just thought that'd be a cool thing. Oh, tennis, running, State University of New York Student Assembly. Oh my gosh, you guys are doing a lot of stuff. Well, that's awesome. Keep up the good stuff, and we'll see how it relates to the what I'll go through. But in general, I just wanted to make a few comments. First, I wanted to say that this is just my personal experience and my path. I think that everyone's path is very different, and I just wanted to normalize that, because there's people who go to dental school right out of college, there's other people who take gap years, some people go from different professions, and that's perfectly okay. So I am a current dental student, but this is not a reflection of my school or different clubs that I'm a part of. This is just from me and what I've learned along my path. I just want you to know that it's good, and I encourage people to shadow and explore different career paths, because personally, I think dentistry is amazing, but I also recognize that there's a lot of other great careers that people can think of within the health profession, especially whether it's physical therapy or medicine, nursing, and veterinary care. And I think it's really important to learn more about yourself, reflect on those, and see what's the best fit for you. And also recognizing that that's difficult during the pandemic, and virtual shadowing might not be accessible, but it is really helpful if you have the opportunity in the coming months. A couple other things I want to say is just do things that make you happy and you're passionate about, because I've learned from myself and my experiences that those are the things that you're going to do best, and you're going to give the most help to others through. And then always try to be doing something and strive to improve. And I think that's just something that I think I've learned and is so important, because it's almost like a gap in the resume sometimes, that you'll want to keep doing things, and recognizing that especially right now during the pandemic. That's not always, not everyone's able to do that, and that's perfectly okay. But always try to be improving in some way, and that's kind of why I asked that question, because although this has been a really strange time, I encourage everyone to try to do something different. And finally, these two are really intertwined. So self-care and support, having a support system and doing things that are to keep you in the best state of health, both mentally and physically, are so valuable. And you're going to need them all along the pathway to whatever career or goal you have. But just continue to work hard and find the balance between these things that you enjoy. Okay. So this is really busy, so I apologize. This is the top part is just kind of like my general journey, and then down here is just different key parts of it. So, and then this is just going to be an overview of me, and then I'll go over the whole process not related to me in a few minutes. So I'm from a small town in upstate New York that has had its own struggles over the past how many years. Well, I was here and during high school, I went to public school. I played tennis and softball, was involved in a lot of clubs in our marching band, and I had a really great time. So I was thinking at that point I wanted to do something creative, very science and medical related. So I went to the University of Rochester, where I studied biomedical engineering. And I thought that was a really connection between the things I thought were interesting. And I really enjoyed my time there. It was a great place, but for a bunch of different reasons, while I was at Rochester, I definitely was involved in mostly leadership experiences, like being a part of like my classes, planning committee, as well as like the planning committee for my hall. And I was like a tutor for elementary school children during the weekend and the weekend. And then I spent some time working at the Oral Health Institute in the records department. And then when I went to Union, I transferred for some family and personal reasons, and another great place. I really enjoyed it. That's a small liberal arts college in upstate New York, so closer to where I'm from. And when I was there, I spent a lot of time working. I spent some time working at animal shelter, and these are my 2 pets as of now. And during that time, I also did some oral health outreach, which was really helpful in my value of learning more about preventative health, especially when in pediatric populations. I also spent a lot of time volunteering at my local clubhouse for teens, and I really enjoyed that. I spent some time tutoring on the side, and I think that through all these experiences, it was a great way to meet people and network. One of the summers I spent working in oral surgeons, I helped solidify my interest for dentistry, and it was really an invaluable opportunity for me to learn more about it. However, I know that that's not always, it wasn't the easiest thing to get, and I recognize that. So I think there's a lot of other ways to explore it, and that's why I really encourage shadowing. I also spent a lot of time learning biology. I really love microbiology, so this is my depiction of that, and caring for family members who are ill. So that's kind of a general overview of my journey. And now I am at Harvard School of Dental Medicine, and I'm just happy to be in dental school working towards a career in dentistry. And you don't have to be a dentist to pursue a career in dentistry. There's also dental hygienists, and now there is an emerging field of dental therapists, as well as dental assistants and people who work in the offices of dental practices, including receptionists and office managers. So there's a lot of different team-based aspects of dentistry. So I'd encourage you look into all of them because they're all valuable and really well needed. So yeah, but I'm going to focus mostly on becoming a dentist because that's where my area of emerging expertise is coming from. So I had some people ask me about why dentistry, and I think that's a really great question. And I think that for me, dentistry is this nexus. So it's a point of connection between all these different things that were super interesting to me. So I was really interested in sciences, as you can see up here. I love the biology of it. I really enjoyed microbiology and everything on like even the cellular level, and I wanted to learn more about it. But at the same time, I really cared about helping people, and especially people who are in pain, and trying to have a more preventative aspect to care, as well as trying to be creative and thinking outside the box, working with my hands and being artistic. And I think that this was this overlap in dentistry that I didn't really find medicine. And although I think that medicine is another great career path, dentistry gave that creative, artistic, and also just like this fun engineering type sense to caring for patients, which I really enjoyed. So yeah, that's why I chose dentistry. But now just an overview of the fields of dentistry. So first, the dentist that you go to on a daily basis would probably be your general dentist. And I do not provide them on here. These are the specialties of dentistry, but they are a very important field. But I know people are asking about the specialties, and there are 12 that are currently recognized by the American Dental Association. One of the newest ones is dental anesthesiology, which does a lot with sedation. Dental public health, which obviously is more on the public health side. There's endodontics, those are the people that do root canals, so they're taking out the pulp and like infected teeth. Then you have oral and maxillofacial pathology, radiology, surgery, and now there's another field called oral facial pain. And oral facial medicine is also pretty new. Prosthodontics is the field of prosthetics in the mouth. So that can be bridges, crowns, dentures, all of those types of things. Periodontics, they are very focused on the gums and the gingiva and their health. Pediatric dentistry is for kids, and then orthodontics is kind of like the braces and trying to fix problems with bite and occlusion, as well as aesthetics. So that's just an overview of dentistry. Now I'll focus a little bit more on the path to dental school. So this is just a really basic outline of the main components of it. But in reality, like I said, there's many steps and deviations, and they're perfectly fine and good. It can actually help you learn and reflect in unique ways. So you go to high school, and then you go to college. And within college, we're going to talk about most of the things that are down here, but you have your prerequisites. Some of them are required, and some of them will be optional, or some schools will require them, but not others. Extracurricular activities get involved in. There's a possibility to do research, jobs, especially because the application process and interviewing can be expensive. So, you know, if that's a possibility and feasible, it could be a good opportunity. Shadowing is a component of the application, and a lot of schools require at least a certain number of hours. I think typically it's between like 50 and 100. So if it is typically a requirement, and it's just important to do so you know that you're going into something that you really enjoy. And I think it's really, I can't stress that enough. Make sure that you really enjoy it before you go into anything really. And then applications. There's a bunch of different parts to that, but just a few main ones are the personal background, even test scores, and then your experiences, your personal statement, which that's your way to tell them what makes you unique, why you are you, why you want to do dentistry, how you got to where you are today, and make that into a unique story that highlights you. And then the supplemental applications for the schools that you typically get either after you apply or before the interviews. And then you have interviews, and hopefully you get some. That would be great. And they all kind of vary, but preparing for them, it's like preparing for any interview. You want to make sure that you know what's coming and what the day is going to look like. And you always want to be respectful, polite, and send them some thank yous, whether they're emails or their paper. It's just nice to have that. And then actually doing dental school. Obviously, I've only done a full year now, but I'll give you a very, very, very just overview of what dental school might look like. They're typically 4-year programs. There's, I think, 66 dental schools, and one of them is a 3-year program. And the curriculums really vary, but we will get to that later. Okay, so just the general outline to becoming a dentist. You get your bachelor's degree. You do a 4-year program at a dental school. Like I said, there's a 3-year program. Then there's dental residencies. So in some states, if you want to be a general dentist and you don't want to specialize, then you might not need a general practice residency. It depends on the state, and state licensing varies very much from year to year. So that would be state dependent. And then if you want to do a residency for all the specialties that I mentioned before, the 12 of them, they're at least 2 to 3 years, and OMFS, oral and maxillofacial surgery, is either a 4 or 6-year degree. Some states, I think there's currently 2 states, including New York and possibly Delaware, that do require our general practice residency for all dentists. So if you want to be a general dentist in those states, you need one. And then fellowships, they're optional additional education for subspecializing. So think like pediatric, oral and maxillofacial surgery, or prosthodontics. They're just an additional step. However, you know, specialties are optional, and the fellowships are also optional. But they could be there. So this is college. I'm just going to go over some of the prereqs now. So you can see that I have split them up. So there's the biology, the chemistry, physics, the non-science, which is like the English, math, and humanities, and then the optional sometimes required. So biology, typically, you will need, this is typical overview. I would always check with the schools before, or on the IDEA ADSAS, which is the application. You'll need 2 semesters of an introductory biology with lab, and then sometimes you'll need upper level biology. That could be microbiology, immunology, histology, anatomy, and physiology. Sometimes you'll need genetics or developmental biology, cell, molecular zoology. And for chemistry, you'll need another 2 semesters with lab, and then 2 semesters of organic chemistry with lab, and then 1 semester of biochem. For physics, you'll also need 2 credits. Typically, they're mechanics and electricity and magnetism. And then for your more humanities-based, you'll typically have to take 2, well, I guess math is kind of related to science. You'll have 2 math courses typically, and they're typically 1 calculus and 1 statistics. This can vary. And then typically they'll ask like 2 English or writing courses. And sometimes they'll require like a psychology class too. So I'd always check on the dental school's website, but this is what the typical overview is like. And if you are attending a college, you'll typically be able to work with the health professions office or the career services office to be able to help figure out a timeline and what you definitely need to do as in terms of prereqs. I really love microbiology, and I thought it could be helpful, but I think that was someone's question was recommended, and I really love microbiology, but I'm a little biased. Anyway, experiences. So these are just a few different types of experiences that I thought were important and are kind of overarching. So first, I just want to clarify, I think that the most important thing is doing things that you enjoy. Like I said before, if you're passionate and you enjoy things, you're just going to do things to a better degree, and it's going to be more helpful, and I think you get more out of it. And you just, just from my own experiences, I did not enjoy doing certain things, and I know that I would have been doing so much better if I had done others. And then the other thing is being unique is awesome if you have unique things that you're involved in. But also, like, I wouldn't say like go out of your way to do something crazy. Like, do what you enjoy, and if it's unique, then that's awesome. Like, something that I did but that was kind of unique was I worked in an animal shelter, and then I fostered cats with my mom for a while. So it was somewhat unique, and I really enjoyed it, and it was great. And then don't be afraid to try new things. I think that is something that has been very helpful to me, is trying things that I never thought I would. And it can really show you a lot about yourself. So with any experience, I think it's important to have the experience and then reflect upon it, and then, you know, apply that later. So learning from everything, really. So a lot of people ask about research. I did not do research, and I got into dental school. And my school actually does a lot of research. And I think that, you know, I think if you're interested in it and you find an opportunity and that's something you really want to do and you're going to enjoy, awesome, go for it. There's many different types of research. You don't have to be just in a wet lab. There's different types where you can do clinical research, translational, there's more educational research or survey-based. So that's totally an opportunity, but you don't need to do it. It can be helpful. There's a lot of skills that it helps with. And it doesn't have to be medical or dental related at all, but it is important that if you include it on your application, to understand your role, the topic, and your experience, because you'll be asked about it and they will want you to know what you're involved in and what you learn from it. And that's true for medical, dental, or any other type of research. So for volunteer work, I think that, like I said, doing what you enjoy, you do things better, you have better experience, and then I think that your overall just tend to be more helpful. It's a great way to broaden your understanding of either different communities or different types of volunteerism, it's just a great way to meet other people and to gain a better understanding of the world. Like I said, you meet people, and something that I think is super important with all of your experiences is to keep a log of the time, the hours, the people that you are being supervised by, because you will need them for your application. And when you're working through your application, the last thing that you want to do is try to figure out like how many hours you're at these places. So right along, I highly recommend keep a log, whether it's paper or an Excel sheet or like Google sheet thing. Like definitely keep a log of the hours, where you were, time frame, and it's just a lot easier. Shadowing, like I said, the most important thing I think is reflecting on these things and really trying to see what you're getting out of them and if you really enjoy it and what that tells you about yourself. So it's great to try shadowing in different situations. So I shadowed in like a hospital that typically it was a hospital residency program that treated a lot of patients that wouldn't be able to typically go to some of these other offices that I was shadowing in. And then I also shadowed in a prosthodontics office, so people that were going there for several different needs, but it was very different from my experience in that hospital clinic. And it was also very different when I shadowed in a private office. So I think it's really important to see all those different situations. And then it's important to build a relationship with these dentists, because you never know when it could be useful, and it's just great to have that connection. And they can also be a potential letter writer for your application. I think that it's important to explore interests and learn if this is a right career field for you, and I think that's really, really so fundamental. And then, like I said, most schools do have an hours requirement. It varies a lot by the school. And as far as leadership and extracurricular activities, I think it's important to explore your interests and to gain leadership experience and see what you've learned and how to improve. Especially because a lot of this will come up in your interviews eventually, and it's great to have stories and ways that you can look and reflect on for different situations. And like I said, keep a log. It's really helpful. So work experiences, they can be dental related, non-dental, they can be teaching experiences, they can be they can be a whole bunch of different type of experiences, really. Like I said, I worked in an animal shelter, so it really can be anything. And keep the info and the names of your supervisors for your application, also for references for other jobs someday. And keep learning about yourself and your areas of strengths and improvements. Okay, now for the DAT, the dental admissions test, which tends to be thought of as like, oh no, I have to take another test. And I will say there's a lot of different ways to prep for it. Just how I prep for it, I got one of the Kaplan books and I used it, but I felt like I really wanted more questions and question banks. So I used the DAT Bootcamp, thought it was super helpful, a great way to learn. But I know that some of these things are like more costly, especially when the test fee by itself is $475. So that's why I think budgeting along the way is super important, because this is just for the test. And then if you do buy prep materials like DAT Bootcamp or DAT Destroyer, which I've also heard is a good, another great prep brand, that costs a lot, and then there's a price to applying to schools, and then there's another cost to interviewing and traveling to interview. So I think it's really important to budget, and that's why the work experience can be really helpful. So just an overview of the DAT schedule. So here's all the sections, the amount of time you're given, and the number of questions. So you have an optional tutorial. So some of these centers that offer it, they're called Prometric centers typically, and that's like the company who that is like an official testing agency. And typically they might ask if you want to do like a practice run, before the test. I would recommend it. I didn't do it because it was a little bit further away from where I lived, but if you can, I would, just to get you more comfortable with it. So I would highly recommend, but definitely do the optional tutorial, because if you definitely haven't done it before, because it'll help make sure that there's no technical issues during the exam, and that's 15 minutes. Then you have 90 minutes for the sciences, and each of those are, both the chems are both 30 questions and biology is 40, so it's 100 questions in 90 minutes. Perceptual ability is very much based on perception. So those are like the cube counting or keyholes, all the more visualization part of the exam. There's 90 questions in 60 minutes. Angles, angle measurements is one of them. And then you have a break. I would recommend taking at least part of the break because it's great for your mind. It's also one of those things where, you know, sometimes you might need to use the bathroom or get a drink of water and get a snack. And you want to make sure you can utilize that time and give yourself that. Then you have the reading comprehension, and you have 50 questions in 60 minutes. The quantitative reasoning, which is more like math, is 50 questions in 45 minutes. And then you have a post-test survey, which is 15 minutes, but you get your results immediately. They won't be verified for your application yet, but you will know what you got on the exam within those 15 minutes. So you have a total of 5 hours and 15 minutes, just under 300 questions. And I know that sounds like a lot, but if you do the practice tests and you consistently practice, I think that especially if you use certain tools, that can be really helpful, and it's not nearly as intimidating as this might look. So I would definitely say to practice. And then as far as applications go, we'll go into that now. Here's just a few key points. So timeline. The process can take pretty much, mine took about 1.5 years, and I say that because my school had a committee letter process where my health professions office wrote my letter recommendation. So I had to get letters of reference from some faculty members and my dentist and do interviews with them. And that was starting in the fall before I applied. And when I applied, I was it was the spring of the year before I went to school. So I started school in 2019 in the summer. So I applied in the spring of 2018, and I was doing the committee process in the fall of 2017. Wow. Yeah, so it's been a little while. Oh wait. Yeah, so it was almost the beginning of 2018 when this all started. And then I started school in the summer of 2019. So yeah, you submit application 1 year before, you matriculate, and then you do the interviews. Interviews, I think they're typically the September to anywhere until the April before school. So I mean, most of these schools start between like August and September, so you can be having interviews pretty late, but a lot of schools will send out their first decisions by the first business day in December. So those decisions can vary. I know that I didn't get my interview at the school I'm attending until after that date, but I heard back from other schools on that date. So, and the other thing is that it is really costly. So I would highly anticipate and encourage you to budget beforehand, because I know that's something that I did not expect, because I did not know anyone who was a dentist who went through this before. So it is a costly process, but just be aware of that. I think there was just a paper published about this if you're interested. Anyway, so the ADIA ADSAS is the application tool. It'll ask for your personal information, like I said before, your history, academic history and grades. You'll have to send your official transcripts from each school. Your experiences, achievements, and licenses. Some people have licenses, whether they be like dental hygiene licenses. Achievements could be different honors or awards even you've had, and experiences could be either dental or non-dental related, volunteering, work, any of those things. Then you have letters of evaluation / your committee letter, then your personal statement, and that's all about your unique story. Supplemental applications, application fees. So that's just a broad overview of what the application process looks like. And then how to pick schools to apply to. And this is something that I can't really say. There's a lot of different factors. Here are some things that I thought about, and there's so many things I'm probably leaving out. So just a few things are location. Location meant a lot to me. Sometimes it doesn't mean a lot to people. Opportunities, and location for me was a lot based on family. But opportunities, like sometimes there's different mentors or specialty programs within that school that you want to shadow and be closer to, or special programs they have, like whether it's in like research or different externships that you find really interesting. And then there's the fit, so the feel of school, the size of the classes, what the student life is like, the education style, because some of the education styles are very different than others. Is it pass-fail? Is it graded? Are you ranked? Those are all different things, also kind of related to statistics with specialty rate and graduation rate. Look at the facilities, the grading. The price is a huge factor. In-state versus out-of-state versus having the opportunity to become in-state and get in-state tuition. And then you have private schools. And dental school is definitely an investment. And it's just recognizing, you know, do you have financial aid and scholarships? And that's definitely a factor. Sometimes these things are more decision-making factors, maybe not as much with choosing, but it's something to think about. And I highly recommend that you apply to schools that knowing if I only got into one school, I'd be happy to go to every single one of these. So I think that that's important. As far as interviews go, some of my key thoughts on this is at the base of the pyramid, we want to be prepared. So you want to review your application materials because everything that's on there is fair game. If they ask you questions about, you want to practice common interview questions. You don't have to have it like scripted out. I think it's really important to have a conversation, but to have key points. Like if I'm asked about my strengths and areas of improvement, here's a few things that I could use. Here's some examples of that. Practice doing mock interviews. I think those are super helpful and they can help you get more comfortable because I know my first time that I was doing it, the first one I did, I felt really good about. The second one I did, I was just overthinking everything. And then by the time I got to real interviews, I felt a lot more confident because I had practiced a lot. That's just for me. Some people might not need as much as I had done. And I know some of the key topics in dentistry. So it's great to be aware. So if you have access to like some of the dental journals, like GADA, you know, maybe read up on a few of them before. They're just like some key points, or just kind of keep up with dental, big things going on in dentistry, like right now, how the COVID-19 pandemic is affecting it. Or if you're really interested in disparities, maybe looking into different studies on disparities, or researching more like the big things that are happening, because you might be asked about that. And think about doing some research into common interview response techniques. So I think there's something called the STAR method, which is you talk about the situation, then your task, then the action, then the result. It's a good way to format things in order to make a good, more coherent reply to an interview question. Then on interview day, you should know where you need to be when, if you have any questions, you can always reach out. But you know, you want to dress to impress. That's another thing that is an added expense. So you want to dress professionally. Typically, you'll be wearing like a business suit and a dress shirt. For females, it really varies. You can wear dress pants or a dress skirt. You can wear flats, heels. I wear dress pants and flats because I was just more comfortable in that. It really depends. And then putting your best foot forward. So always be polite and respectful to every single person. You know, make sure that you're trying on time and you're, you know, just putting your best self forward. Obviously, you don't want to be someone that you're not, but, you know, make sure that you're feeling like you're doing your best. Absolutely. And then make sure you have something to take notes on. These are called padfolios, and they're pretty typical to see. And it's just pretty much like a, you know, almost like a flip book with note paper in it. And I think that's really important. Just to take notes during whatever information sessions they have, or at the end of the interviews, if you ask questions. I would always be prepared to ask questions about the specific program or school. A, it shows that you're interested, and B, it's just a great way to know more about them and things that you're just interested in. And then we're moving up the pyramid. You want to give your all and recognize your verbal and non-verbal communication. So just be genuine and show you're interested. So that can include smiling and just trying to show that you're paying attention during all the presentations. Don't check make sure it's silenced. And just show that you're present and paying attention. Feel free to ask students questions because they are the experts. They go there, they know what it's like every single day, and just try to get that feel about the school. Like, am I going to be happy here? If I get in, is this, or if I have the option, is this the school I want to go to? And then ask them questions. Like I said, it's great to have customized questions to ask students like tour guides or the interviewers. And then at the end, I think it's really great to send a thank you and just be polite, respectful, considerate to all the people, student interviewers, the people who greet you on that day. It's a great way to, have them remember you. So what better way to reflect than sending a thank you note or email to each person. And I think that I just sent emails pretty much, and it doesn't have to be anything too much. You can even have like very generic outline, and then you fill in something more personalized in there, and it's a great way to make them remember you. Okay, and then if you are lucky enough to have a decision on different schools, which I really hope you do, here are just some things that I would remind you. It really depends on your priorities. I think it's really important to realistically evaluate the price and how that weighs against the opportunities. I think that that's really important because some schools can be very expensive, and if you do not get much financial aid or scholarships, then I think that dental school is an investment, but you want to make sure you feel comfortable with that investment. With that being said, I think that it's important to apply and to go places where you would be happy to attend. So I would suggest not applying just to apply to different schools. I would take the time and seriously think about where you want to go. And then just be realistic about your needs and priorities, and what you're willing to sacrifice in order to get the right things. So for me, like I was willing to sacrifice certain things to make sure I had the right location. Okay. So then just a quick overview of dental school. And this is kind of what I think of it as. At least this is what my experience has been. So first you have your didactics and your basic science/dental education. So this is more of your lecture based, learning the basics, learning your dental anatomy, what occlusion's like, learning the basics of the sciences that you learn in college, but how it relates to what you'll be doing in your career. Then you start to work on these mannequins and things called typodonts, which are like these fake teeth. And you get to work on your hand skills and what you're actually going to be doing to real patients eventually. And then you actually get to the clinic, and you'll get to see patients, you get to practice and, work with patient management and really get to do what you are going to see and want to do later in your education. So this is actually at the University of Buffalo, and I think this is at University of Pennsylvania. They both have beautiful clinics. And then general advice that I have for you, just as my final thoughts. First, I want to say do things that you enjoy. I think that's so important. I think it's also important to just work hard at wherever you do, because it'll reflect better on you. I think it's great to create a unique story, especially in the application process when you're doing your personal statement. Find something that shows why you're interested in dentistry, how what you've done connects to you and your values, and then what you want to do in the future. And just try to be you. It's not about being cookie cutter and checking off a list of, okay, I did research, okay, I did volunteerism, okay, I did these requirements. It's more about doing things that you enjoy while, doing the things that you definitely have to do and filling time with other things that you're interested in. So seek out opportunities. Sometimes they're there and they'll present for themselves, and sometimes you have to seek them out. So for me, I volunteered at the animal shelter that I worked at for a summer, and then thereafter on weekends, and it presented itself. I actually sought out tutoring opportunities, and that's how I found the clubhouse that I ended up volunteering at. It was great. But I think these other things are just other really important takeaways, like be polite, respectful, and professional throughout pretty much all of your career. I think that those are things that are so important. I think it's kind of like the golden rule: treat others like you'd like to be treated. I think that's so important. Enjoy the process. I really loved the application process and interviewing. I got to meet so many people who are interested in dentistry, get to hear their stories, learn more about them, and some of them might actually become your colleagues, well, or even your classmates and then colleagues. Don't be afraid to ask for help. I think that's something that's really underrated, and whether that is from your career services to help with a resume or mock interviews, whether that's a professor because you're just not getting what's going on in chemistry, I know how that feels. Always feel free to reach out. It's important to find that support network. Sometimes it's mentors or faculty, sometimes it's family or friends or people that just come into your life that you would never expected. Make sure to care for yourself. Like I said in the beginning, self-care and support are two things that are so important throughout life, and these paths that you're looking to go into can, be quite long hauls, and it's so important to make sure that you're caring for yourself. So exercising, eating well, taking time to reflect and to meditate, get good night's sleep, whatever works for you. Then reflect on what interests you, why, and your goals, because not only is this helpful in the application process, but it just helps you get more out of life and your experiences and to learn more and apply it. So that's why I say, if you have an experience, make sure to reflect on it and apply it, because this is something that is actually kind of new to me. I have not really been the most reflective person, I have found out. And this is really helping me figure out, why am I doing these things that I'm doing? What is it going to help me with? And why do I want to? And how am I going to keep working towards it? And other things I think are important are just forming these skills now. It's important to be efficient because you are going to be busy people, I'm sure. Make sure that you're communicating with other people well. I think that's so important, and it's so helpful to people's success. Being self-aware, coming back to the reflection, time managing, like I said, you're busy people, so it's important to make sure that you're being organized, setting this time for yourself so you know what your priorities are and how you're going to invest your time. And then set goals and then reevaluate once you hit them. Okay, so this is my email. Feel to reach out to me whenever. I'm going to just quickly go over the last few questions that were also asked, and then I'm happy to go over any other ones that are in the chat. So first, what would we recommend for a rising senior to do to prepare for the dental future? First, I think it really depends. It depends on where you are in this process. If you're applying to dental school, I think that it's really valuable to spend time to really prepare for interviews and come up with a budget and figure out what you want to do in dentistry. If you're not there yet, which is perfectly fine, like I said, like I took a partial gap year and I worked in a student success program in my local middle school as a tutor. And like I said, perfectly fine. I know people who went back to school in their 30s or even later, so perfectly fine. But what would I recommend? I think the main things are to make sure you're always doing something and doing it well. I think that it's important to take time for yourself and care for yourself, especially right now, because things are really weird. If you haven't shadowed yet, I think it's really important to try to get some shadowing in. I don't know if there's any virtual opportunities, or just even calling a dentist and seeing if they can talk to you. Maybe some dental offices would be willing to. I really don't know, but it'd have to be within regulations. And as far as other things that the rising senior could do, just keep making sure that you're, doing as well as you can with your grades. I'll go over that in the next question, but have these experiences, keep good connections with your faculty members, especially if you're going to be asking for letters of recommendation. If you're looking for a job, then definitely spend some time and invest in that and work with your career office to get a resume and some cover letters set up. And I know that rising seniors, there's a lot of things that you're experiencing, and I also encourage you just to really enjoy that senior year, because I think that there's definitely a whole list of things that you could definitely do, but you want to make sure that you're getting the most value of the things that you're doing, and I think that connecting with other people is a huge thing. So I know I'm saying a whole bunch of things, but I hope it makes sense. How to maintain good grades in undergraduate years. So I will be the first person to say that when I went from high school to undergrad, I went from I went to a lower ranked public school, and I went to a university that I thought was quite challenging. So my first couple semesters were not that great. I did fine, but definitely not what I would have wanted. And I think the most important thing for me was not to overburden myself with things. I think it's important to time manage and prioritize and things that really mean things to you and you're going to get value out of. And when you're time managing and prioritizing, spending time to actually, I scheduled out my month at a week, at the beginning of each week at one point, because I just needed to. So every Sunday, my classes, I'm going to go to the gym in the morning, then I'm going to come back and I'm going to shower, and then I'm going to study before class. And then in between classes, I'm going to get lunch here, and then I'm going to do this particular thing. And I think that that was so helpful to me. And then the most important thing was I took time and I was like, I'm going to call my significant other here, and I'm going to talk to my parents here, and I'm going to just go hang out with my friends during this spot in the evening. I think that that's also important, because sometimes we can get so focused on grades, 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 performance, and we start to lose the connections that are really important. So I think that maintaining your grades comes back to time management and organization, as well as if you feel like you're not doing as great as you want to be, feel free to reach out and seek help. So go to office hours, reach out to your TA or professor, and just say, listen, this is what I'm doing. What do you suggest? What I've learned is really helpful is spaced repetition. So after class, going through the note, and that evening, just looking at them again, or flashcards. That can be a great way to have spaced repetition. That was something that I've read in some books, and I think it's really helpful. I think it varies. I think some people find them helpful, and other study techniques aren't as helpful for those people. So find things that work for you. Feel free to explore and try different things. But also, if it's just not working, like I've also, since being at school, I went and met with a learning specialist who was able to help me figure out different ways that I could keep changing things. And the summarizing was a huge thing for me, to just reflect and consolidate my understanding. So I think that I have gone through everything. Let me see. I think so. I'm going to stop screen sharing, and if anyone has questions, I'd love to answer them. I hope that I helped. Okay.
Yeah, we have a couple of questions in the chat.
Awesome. Let's see. How do you suggest we go about shadowing? That's a great question. Right now, I think that that is kind of everyone's question, because it's so difficult and limited. I guess my best suggestion would be to at least reach out to some dentists, whether it's a dentist that you go to or someone else that you know, and ask them, like, hey, I'm interested in shadowing. I know I might not be able to right now. And also, I can actually send you like a template. I can send that to Annika, but a template for just like how to reach out in an email. Sometimes you can call, and sometimes it's great to email, and just explain, like, hi, my name is Christy Kaczmarek. I am currently a blank blank studying blank here. I'm interested in dentistry, and I want to learn more about it by shadowing. I recognize right now that things aren't as accessible because of different federal regulations and safety precautions. I'd also love to talk to you about your experience in dentistry. If this is possible, please let me know. Here's my contact information. I really appreciate your time. Thank you. And then Christy Kaczmarek, like something like that. And I think that that's a good way, because at least they have you on the radar, so that when that can be a reality, they'll reach back out. I think it's really difficult right now, though. I think I don't think that there's many like virtual shadowing opportunities, just because of HIPAA and other patient privacy. But I think that would be the best thing. There's also different, obviously Medvocate's doing their webinars, but you can also look in like the American Student Dental Association. They might have different events going on. They might not be shadowing, but they might be slightly more dental related. Let me see. What is the next question in the chat? What did you do to stand out when applying to Harvard Dental? That's a great question. I don't know the answer to that. I think that it's true for any school. You want to stand out, and you want to put your best foot forward. For me, at least, I ended up applying to around like 10 schools, so it's average, but I actually added Harvard on at the last minute, because I actually never thought I would go there, and I was like, I might as well apply. And then I heard back in like February for an interview and really loved it when I went interviewed. And I decided that was going to be the place that I wanted to go. But as far as standing out, I think that it comes back to having a good personal statement is a huge part of it, and that leads into the interview. If you can take all your experiences and kind of look at them, and whether it's on a resume or just a list that you have, and look at them and be like, okay, what did I learn from each of these? How does this relate to what I'm interested in? Why is it? How did I learn these things from each of these? And what I did to craft my personal statement was I wrote it and rewrote it a lot. And I had a few different people look it over. And at first, I really hated my personal statement. I didn't think it was a good reflection of me, my writing, anything about me. And then I just kept rewriting it. And I'm not saying I rewrote it like 40 times, but I rewrote it probably like 3 or 4 times. And each time it was pretty different. But I think that by the time I was done, I had listed, for me, I kind of did like an order of, this was my journey in like more of a timeline, chronological order, but explaining what I got out of different experiences. And I think that that was a great way because it can help me connect, because each experience I pull back to what I'm interested in dentistry and what I learned about myself and what I wanted to do as a career, and my goals. And I think that that was really important, was having that solid, unique story that tells them about you, your values, and what you want to get out of education. I think being prepared for dental interview is really important too, just because the less stress. I get really nervous when I do interviews. I mean, even now I'm a little bit nervous. But I think that the more you feel comfortable, the better you'll be able to show them who you are. And that can only be a helpful thing, because I think a lot of people who apply to dental school are just really great people, and obviously dentists for really good reasons. So I think that spending the time to really get to know your story and get comfortable with who you are and why you want to do what you do, I think it was something that was really important. It's just like really having the solid understanding to base off the rest of your application. I think like people can say like, okay, like you'll want to have good GPA and DHE score for sure. But at the same time, like that alone won't make you a great dentist. I think making a great dentist is someone who can understand patients and is empathetic and wants to know how to help other people and is willing to do that. So I think that there's a lot of different factors, and I can't say exactly why. Like, I don't know why I got in, but we are where we are. And I think that for me, a lot of it was based off of like just taking the attitude of no matter what, I just want to be a dentist of some sort, and I want to help people, and no matter how I get there, that's what I'm hoping. Yeah, I hope that helps. Can some of these prereqs be met by AP credits? That's a great question. I think it depends on the school. I definitely had AP credits for a couple things, but I'm not sure if every school was as willing to take them. So I would definitely reach out and check. But I think that some schools definitely were. I'm not exactly sure on that one, but I think some of them can, some of them will. But you can always check on their website, or I think it might also be on the AdSAS application. How do you make sure that you don't overload on extracurricular and leadership commitments? I have a hard time backing out once I say yes to people events and clubs. Yeah, that's a great question. I had that problem a lot when I was at Rochester. I feel like I was just taking a lot of stuff, and I wasn't prioritizing and time managing as well as I wanted to. And what I would say is, what I've learned is to take on things slowly. And I think it's hard because sometimes you go to like a club fair and you're like, I want to get involved with everything. And then every project or opportunity that comes your way, you say yes to. And I think it's great to go out for opportunities. But I think it's also valuable to let people know that it's okay to determine that you're not able to do everything also. And to just let people know that and be like, you know, I thought I was going to have time for this, and I really wish I did. But as of right now, my schedule is just not going to allow for it. And I know I hope that I might be able to again someday, but as of right now, I just can't. And I think that it's always better to, start slowly so you don't have to do that, because I know it's kind of uncomfortable. But I think that if it's not going to be it's not going to benefit you in the end, and you're going to be more stressed and overwhelmed, I think that it's okay as long as you're upfront and honest and you do what you need to. It's kind of coming back to that self-care. Like, you got to do what matters most. And yeah, that's what I learned. Just slowly take things off, because it is hard to not overload yourself. Learn more about how to be effective. So whether that's like stop looking at my phone as much while I'm studying, or like, because I know that personally, like if my phone goes off, like I'm checking it and then I have to reset myself. So I think that that's something that's helpful, and just trying to use those study tools. How is your dental school experience being impacted by COVID-19? Well, that's an awesome question, because it's pretty different, that's for sure. So I think everyone's dental school experience is a bit different. So as of March, we were virtual, and we've been virtual since. I think I'm pretty lucky, because at my school, because of where I am in my education, I am doing mostly lectures anyway right now, so I'm not really doing much hands-on. But I would say it's been affected in a couple of ways. The first is that, unfortunately, we haven't been able to see patients, and we're not able to actually go and shadow, which would be really helpful to help solidify interest. And then we're not able to go into the free clinic right now. That's reserved for other years. So we're doing some of the exercises from home. So like we're carving out of wax at home, which has been fine. I think it's all very much based on how you look at it, because it's definitely been affected. I think we've been very lucky my year. I think upper class years have been definitely more affected, because they're the lab is definitely more limited. I think that hopefully this will be better within the next school years. So people who are going to school now won't be as affected, but starting off school for sure, it's definitely difficult when you're virtual. So anyone who is starting, I would just recommend like trying to reach out and make connections with other people and organizations, because it's just a good way to feel involved, because I know how it is being virtual. It just feels a little weird. Did I ever reach out to dental students from schools you were interested in to learn more about pros and cons of the faculty? If yes, how did you approach them if you don't have any contacts who are from the school of interest? I actually didn't really have many dental school contacts. I didn't really know anyone who was a dental student or was going to dental school. I think there's definitely organizations like ASDA that could probably help with that. I know there's Student Doctor Network that seems to be a resource for people online. But of course, those are also people's opinions, and like this, these are just my opinions, so take them with a grain of salt, please. But that could be a way to locate people who are from the schools. I think that if you narrow your the schools down to the ones that you're genuinely thinking about, and you apply to those at the interviews, for sure you'll be able to find students, whether they're your tour guides or sometimes there's social events that you can go to, or even just having them stop in to say hello, which happens a lot. You can get their information. You'll typically be able to ask them more about the school and everything. And I think a lot of times people are pretty honest, because students typically don't have much of an incentive to really move you one way or the other, because you're just another student. It's not like they're on the admissions committee or part of the school. They're just going through what you're going to be going through. So I think that they're a great resource, and typically I would get the most out of it at the interview. Like I said, you could do Student Doctor Network or possibly through ASDA as other alternatives. Do you have any tips on balancing academics or extracurriculars from personal life when things feel overwhelming? Oh, it's such a good question. um, so I think that for me, what's been really helpful is I've been with my significant other a long time, and they are not in, they haven't been in school for a while now because they graduated and didn't go to graduate school. And they are a good reminder for me. So having people who are not within the fields are very important, because I think when it's me and my friends, we just get very bogged down and, oh my gosh, we have all this going on. We have to work on these projects. We have to make sure that our carvings are perfect. We have to make sure we're studying on these exams. And it's so important to have those friends and family who can remind you of, okay, I want to be a dentist, or I want to be X, Y, or Z, and being able to almost remove yourself. I think that the one thing that has been great about virtual for me, and I don't think that I recognize it's not true for everyone, because everyone's situation is very different. But where I am right now, I have a room where I'm able to sit at my desk for classes, and then when I'm done with classes or work, I can get up and leave. And like, that's how I know this is my space for classes. And I'm here, I work, and am I always really focused? No, I'm not perfect. I do not, I'm not great at focusing virtually. I think a lot of us have problems with it, but I think it's great to have that space. And I think that the most important thing is to schedule in personal life things and to make them just as important as school. Like if you're hoping to call a friend or eventually like meet up with a friend for something, schedule it in and treat it like it's a class or an assignment, like, or to call a loved one, like call a grandparent or someone. Like, I think that's a hard thing. Sometimes we put these things on the back burner that really shouldn't. And I know I'm guilty of it. I think scheduling is a huge thing. And as far as being overwhelmed, I think the most important thing that I've learned is to remove myself from the situation when it's possible. For me, I have pets, so like I will just spend some time like petting my pets for a few minutes to just cool down, because it's not always easy. Like there's a lot going on. But also, I think the most important thing is to put things in perspective. I think there's definitely times where we go through and we're like, oh my gosh, I don't get, it's going to be horrible, get like a crazy score on the DAT, it's going to be horrible. It's like, no, I think that the goal is my goal was to be a dentist and to help people. And I think that if we put things in perspective, it can be a lot helpful. Also, I recognize it's forced, so like, don't feel like you have to stay. Anyway, you guys have the quiz, don't you? Forget about that. I'll just go through this really quick. If you want to do that, let me know and I can stop.
It's just a link, so they can do it like after it's done. You don't need to rush.
Okay. But yeah, don't feel like you have to keep listening to me. Anyway, let's see. How do you like being so close to Boston? Any things you do in the city to balance and help with your mental health? I plan on transferring and love the atmosphere. Yeah, I really do like Boston. I'm from upstate New York, so the biggest city closest to me for the longest time was New York. And I think for me, New York was just overly stimulating. And I like Boston because I actually lived a few different places in Boston. Right now, I actually live about 3 minutes outside of Boston, closer to where my significant other works. And no matter what, I really like going for walks, and obviously the dog. So spend a lot of time with him walking, and that is the best thing for me, because in Boston there's a lot of great places to walk, whether it's along the Charles River, on the Emerald Necklace trails, or at many of the parks. It's a great city to get out and walk and spend some time. You can also go kayaking on the Charles or biking. But for me, walking was always super accessible, because no matter where I went, there seemed to be some type of green space nearby. I think there's certain neighborhoods that tend to not be as accessible. But for me, luckily, there's been a lot of places that I can get outside, and that was definitely the best thing for me to balance. And I think mental health is so important. But or meeting people and then going on walks or sitting around. Like I met one of my friends at Tufts the other day just on like their yard, and it was beautiful. But it was great just to be able to connect. I like being in Boston, though. It's a great place. I think the city itself is very livable. I really like the city itself is really historic and has a nice vibe. I do like it a lot. If I was going to live in a big city, I like it. And I think that is it. Anyone else with any questions? If not, I hope that was helpful. And feel free to reach out to me. I'll put my link, my email in the chat. Thank you guys for having me on. If you have any questions or things I didn't answer, great, let me know.
All right, thank you so much, Christy, for being here with us. Your advice and your input is so useful. Thank you so much.
Yeah, of course. Thanks for having me, everyone.